let's first talk about you and how you kind of fell into this clinic today.
Sure.
In your world. But 10 years ago, you suffered a horrific stroke.
I did. So my background is I was a paramedic. I worked for the Woodlands Fire Department. I married my chief, and that wasn't kind of good.
Scandalous. Oh, he's right here, too.
Oh, he's right there.
Wow, don't worry, we won't tell.
So consequently, that wasn't good. So I became a director of the college. And during that time, a lot of stress, starting up a program. And so I suffered a subarachnoid hemorrhage, a brain bleed. Consequently left me in ICU for about a month. I don't have any recollection of it, but the care that I received was just phenomenal. My husband says that got a really good, the care was great. So I became a nurse, and 10 years later, fast forward, I decided to open up a clinic.
Wow, and the pictures that we're seeing on the screen right now, the one before this, they essentially removed part of your skull. The recovery looked grim for you, and this experience, now you've clearly bounced back, but this experience really gave you a lot more empathy for folks in the community who do not have access to low-cost health care.
I was fortunate. I was very fortunate to have the first responder. It's a brotherhood. When I got sick, there must have been maybe 50 firemen in the ER just shoring up my husband. Obviously, I don't have any memory of that, but my husband obviously was the one dealing with that. So they helped him, and then all throughout the ICU care, the nurses were phenomenal. All I knew was pre-hospital. I really didn't understand hospital care. My bill was over $1 million.
Whoa.
$1 million.
Incredible.
So, and he was my advocate. My husband was my advocate. But I'm like, gosh, what about those people that don't have,
insurance?
Right.
Yeah.
And so when I became a nurse, I saw the challenges that our country really deals with. I was very frustrated, just because of insurance greed, doctors, so forth and so on. So I told my husband, that's not fair. So, we've kind of gathered up all of our money, decided to open up, a low-cost clinic. When I opened it up, the name of the clinic as well as the day that I opened it was very, very intentional. Obviously, we opened it up September 11th. First responders, first response family clinic.
Yeah, it really does have true meaning to it. Should mention all around, while you were getting your care and recovering, your husband was by your bedside and walking you through that, but you also were raising 4 children at the same time. So talk about the impact of all of that. And now you realize how impactful what you're doing in the community to allow these families to not have to worry about the medical care and the treatment that they need, and some people forego.
Oh my gosh. So we have 4 kids, Joey, Laura, Nikki, Danielle, and they really suffered the same. I was out for 2 years recovery. I had to learn how to walk. I had to learn how to talk, and the children don't know anything. They want mom back. I'm very, I was PTA. I was just like, I'm a Mexican mom, it's like, I don't know now. I know how to burn the candle at 2 ends. And my husband having not only to nurse me back to health, but also to be there, for them was a big challenge. So fast forward, now we're empty nesters. So I'm like, well, what do I do now? I'm healed. I've done my career, I've done my education, I've done my mom thing. What do I do? And so now it's like, Maslow's hierarchy, give back, so it's time to give back to the community, time to, help the uninsured, or help the, how many times now in the season of flu or strep, you call your doctor, even if you have insurance, I'm sick, I'll see you in 2 weeks.
Yeah.
You don't want to wait 2 weeks. Come to my clinic, I'll take care of you in and out, 15, 20 minutes tops.
Copays can be huge for people, even with insurance. One of the foundations of your first response family clinic, Desi, is to treat the community as completely as possible with the cheapest and most affordable way. An office visit costs just $45.
That is correct.
That's it.
That is correct. You come in, $45. We don't take insurance. I don't do any kind of Medicaid, no Medicare, no insurance. I just don't want the government really into my clinic. But $45, you can't beat it.
Right.
You come in, I treat you, I can give you antibiotics, I can give you whatever kind of treatment you need, and then, you're on your way. Last Friday, I had a lady, an older lady, she had pneumonia, treated her completely. She walked out with less than $300.
That's great.
My goodness.
That is awesome.
By the way, fully bilingual staff, cash, credit cards, Apple Pay. You also give back to the community by donating a portion of your revenue.
Correct. I know what our career can bring, ugly side, of what we see, so I do give back to PTSD Foundation.
Oh, it's wonderful.
Yeah.
Desi,
Yeah.
it's great to meet you.
Thank you
and
so
continued health and success to you as well.
Thank you. Thank you.
In the meantime, if you would like to schedule an appointment or for more info about First Response Family Clinic, you can call 936-231-8610, or you can visit frfclinic.com.
And we'll be right back with more Houston Life.